Welcome to the Smart Life 2020 live Facebook event.
We're coming to you via Zoom on Facebook to bring you this special program.
The program is called Managing and Surviving Coronavirus. And today we're going to speak with medical professionals, a teacher, and two survivors. We're going to bring you the facts. We're going to hear powerful personal stories and, of course, answer your questions. So let's get started right away. Our first guest is Dr. Kamal Kaur. She's a family physician with Baptist Health Primary Care Group, and she has been in the trenches from the beginning of the corona crisis. Welcome, Dr. Kaur. Thank you so much for your valuable time.
Good morning. It's a pleasure to be here.
Good to see you, Dr. Kaur. Good to see you again.
Likewise.
Dr. Kaur, tell us what health professionals have learned so far about the symptoms of COVID-19 and who is really at risk.
Sure. So we've learned a lot more since all of this started back in December. Initially, we thought that the symptoms were restricted to shortness of breath and cough, so mainly the respiratory system. But we've seen that other parts of our body can be affected as well. So now we're also seeing sore throat, loss of taste or smell, fevers, chills, muscle aches, and some people have even had gastrointestinal symptoms such as diarrhea, nausea, abdominal pain, and then of course we're still seeing the worst of the respiratory symptom and complication, pneumonia.
And doctor, if I could ask you, what about blood clots and strokes in younger people that we're hearing about?
Yes, so this was quite a surprise to us as a medical community. This came out of left field. We were not expecting this with this virus, but for some reason we have seen that this virus attacks our blood vessels and certain parts of the cardiovascular system in such a way that it predisposes and puts us at a high risk for developing clots. So whereas a person might not be presenting with classic COVID-19 symptoms such as the respiratory cough and shortness of breath, all they're presenting with is clotting events. We're still investigating this and trying to figure out why this happens, who is most at risk for this, and what we can do to best treat it. Sometimes, and for various diseases, we've seen that not just one medication, but a whole cocktail of medication helps to treat that disease best and even cure it sometimes. And the reason is because the different medications target different parts of the immune system. And just like you said, recent studies have shown some positive outcomes for a drug cocktail that involves a few antiviral medications and an interferon beta medication. Now, we still need to get more results on this, but it's promising because that particular study showed that it was easier and quicker for patients to recover from COVID-19 when they were given this particular drug cocktail. Now, as far as the vaccine goes, that is something that we're all hoping for. And I want people to understand that vaccines take years to concoct and to make sure that they're valid, they're effective, and their side effect profile is low. So if we do come up with a vaccine before the end of the year, that would be absolutely amazing, nothing less than a medical miracle.
Doctor, until we have a vaccine, a lot of people are kind of losing patience and really want to get back to work and want to get out there socializing. What would be your concerns as a doctor in the medical field? What are the biggest concerns that the country and our state will happen if we open up?
So I know we all want to get back to a normal or what's going to be our new normal, but I do urge people to continue practicing social distancing. Just because places are opening up, and granted they're opening up with certain restrictions and precautions in place to reduce exposure, I do want people to understand that those measures are still very important. Please don't forget to wear your masks. Please don't forget to stay 6 feet apart. And the reason for this is because we don't want to go backwards. We don't want to take 10 steps back and have another surge in infections.
You know, speaking of that not going out, a lot of people are afraid to call 911 because they're afraid of going to the hospital and getting the COVID. What do you have to say to them about that?
That's been an unfortunate side effect of this pandemic, is that people who have symptoms that are completely unrelated to COVID-19 but are life-threatening or very dangerous to their health are not reaching out for help to us because they feel like if they come into a doctor's office or go to an urgent care or go to an emergency room, they're going to be unnecessarily exposed and even contract the virus. But I want people to know that we have set in place certain precautions and make sure that these protocols are there to reduce the risk to our patients and to ourselves.
Doctor, I have a couple of questions I wanted to ask you. Going back to just the general population and obviously the concern, we heard a lot about, people over 60 are more at risk. Who is most at risk today? And then I have a follow-up after that.
Sure. So essentially, we're all at risk, right? But just like you said, there's a certain group of people that are most at risk. And these are people who are having immune systems that are not up to par, that are not 100%. And this does include the age group over 65. It includes individuals who live in nursing homes, who live in assisted living facilities, and people who have chronic medical conditions, whether they're controlled or not. And then we also have to consider people who are undergoing dialysis for chronic kidney disease.
And doctor, any personal stories that you may have of patients you've seen, whether it be someone in their 20s, 60s, 70s?
Sure. I've actually seen patients of all ages with mild to moderate symptoms of COVID-19 and some with even severe that I've urged to go to the emergency room. And the one thing that I've seen across the board is that people are remaining vigilant about their symptoms and through telemedicine are reaching out to us for advice. And I do encourage people to continue seeing that. But for the most part, I'm seeing people recover just with supportive care. Very rarely have I personally had a patient that I've sent to the hospital and they've been in the intensive care unit.
You know, doctor, we've been talking about patients, but I have to ask you about healthcare worker burnout. I mean, you look fantastic. You don't look like you're burned out or anything, but I'm sure it's because you got ready for today. But there's been a lot of concern about the healthcare people and the front lines getting burned out. It's just a lot of work and a lot of stress. What's going on with that? Are there any ways to minimize that?
Sure. So as healthcare providers, whether we're physicians, nurses, anybody that works in a hospital, we're all used to a certain amount of stress and we actually expect it. But when we have something like a public health emergency and the COVID-19 crisis, that gets increased exponentially. And we're so busy sometimes taking care of others and taking care of our families that we forget to take care of ourselves. And that's when I think burnout really works into the equation here. So for those reasons, and I'm so glad to see this around the country, around even our South Florida communities, there are so many resources out there for healthcare workers and first responders to reach out to if they're feeling overwhelmed, if they're feeling burnt out. Because, you know, even heroes need a shoulder to lean on, and we want to make sure that we're taking care of ourselves so we can take care of others. But let me tell you, it is overwhelming at times, and the burnout is real.
And when we use the word overwhelming, there's no doubt that there's so many people that want to get out there, like we said, normal lives. As our counties start to open up and you start hearing that more counties are opening up, do you have any concerns about that? And maybe what advice would you have to us, to those that are now seeing these openings? What would you say to them?
I would say proceed with caution. You know, just because places are opening, I don't want people to forget to wear masks. I don't want people to forget to socially distance themselves from others. But I do want everybody to be respectful of each other and know that whatever we're doing, it's for the safety and the greater good, because we do want to reduce transmission and fight this battle.
You know, you mentioned masks. Just one of the points is that there's a lot of rumors going around, and masks don't really work. As a matter of fact, they make it worse. I don't know. Who should we listen to? What authority, what sources should we go to? Should we get various different opinions, obviously? What would you?
So with social media and the internet, we have access to so much information that it can be overwhelming at times, and you just don't know what to trust and what to listen to. But I do urge, the CDC is always a good guide. The WHO websites are always a good guide, and your local and state governments. But as far as masks go, I want people to know that they're definitely so recommended, and they're recommended not only to protect you, but mostly to protect others, so that if you are an asymptomatic carrier of the virus, you're not unnecessarily and inadvertently passing it on to others.
What is the question you've been getting the most, so we can maybe educate everybody with your answer?
Sure. I think a lot of what we talked about is what's on people's minds. The most common question that I'm still getting is, do I have COVID-19? Am I at risk for COVID-19? What should I do to prevent COVID-19? You know, and as more information comes out about this virus, people are inevitably going to want to know which treatment is the best. Is there a treatment out there? When's the vaccine coming? I mean, there's so much that's unknown about this situation that the questions are endless at this point.
Doctor, we want to thank you for your time. I know how busy you are. We truly appreciate you being there on the front lines, and God bless you. And I know hopefully we'll get through this.
Thank you so much. Yeah, I urge everybody to contact your primary care physicians, continue to contact your doctors. We are all in this together, and thank you both, everybody.
You're welcome, Dr. Kaur. It's great seeing you, and we hope to see you again, maybe under better circumstances. But thank you for joining us on The Smart Life. We appreciate it.
It's my pleasure. Have a good day, everybody. Be well.
during this time when there's so much focus on our physical health, it's important not to forget, Olga, about our mental health. Is that correct?
Absolutely. And with all the changes happening, Derek, as we face this pandemic together, it's easy to feel, I mean, there are so many adjectives here and verbs, but overwhelmed, depressed, and stressed.
To help us ease our minds, as a matter of fact, is Amy Exum, a psychotherapist with Baptist Health, South Florida.
Good morning, Amy.
Good morning. Nice to see you both. I got the red memo, apparently.
Oh, good. Awesome. Great.
Amy, it's so great to have you. And again, another person on the front line and busy. Obviously, the coronavirus not only affects our physical health, it just causes a lot of psychological suffering. I mentioned some of them: depression, anxiety. It's a huge concern. And I would even say, Amy, and correct me if I'm wrong, that even something that we're seeing in people that have never had any mental health issues at all. So as a whole, as a society, why are we having such a hard time with this pandemic, in your opinion?
Yeah, it's such a good question, Olga. And I'm really glad that we're talking about this because it actually is Mental Health Awareness Month. And I want everybody out there to know that it's absolutely okay to feel worried, anxious, and even fearful at this time. But as you said, a lot of people are struggling, and people who have never experienced these symptoms at this heightened level before. And there's just so much uncertainty around the virus that we're having to deal with. You know, here in South Florida, we're used to kind of some major events. We think about hurricanes, or even the area of the country I'm originally from, we have tornadoes, earthquakes, and those things come and go. And we know there's a beginning and there's an end. And with this, we really don't quite know when that end might be coming. And then on top of that, it's just making kind of our daily activities much more complicated. Just simple tasks that we used to do, going grocery shopping, getting our needs met. It's just much more challenging. And then on top of that, we're thinking about, concerns for ourselves, our health and safety, other people's health and safety. And it's really not isolated to just one area. It's really something that's global. And I can have family here in another country, and we're worrying about so many people at the same time. So there's a lot of uncertainty. And then on top of that, we're thinking about how many of the ways that we used to handle stress or cope with stress, we can't necessarily do right now. I can't just go out and jump to my dance studio and meet with my friends. I can do it a little bit of a different way, but it's just not the same.
On that note, exactly my next question was, we humans, we're social creatures. We have to be around people, most of us. Can social distancing lead to, obviously it leads to fewer personal interaction, but can the isolation make it harder to control our stress and our emotions and our anxiety? We can't bounce our ideas or concerns off anybody because we're stuck in the house, in a sense.
Yeah, you're very right, Derek. We're human beings, we're social creatures. And although some of us may be more introverted and might be thriving a little bit better during this time, for many of us, like you said, it's hard to not see people, just to run off ideas, walk down the hallway in our offices and say hi to people. On top of that, we know that some people have less access to resources and technology. So it can be even more challenging for them as they're going through this, because they may be living alone, or their caregivers might be sick or occupied with other things. So that lack of interaction can be so challenging. Sometimes I get a little tired of talking to my dog, who's my coworker, throughout the day. It's nice to have interaction, and like you said, and just not know that you're so alone. The former Surgeon General Vivek Murthy has been talking about how loneliness is such a major issue in this country, and really across the world, and how there's so many health impacts besides mental health that come along with loneliness. And then on top of that, again, with everything that we're dealing with, we're much more isolated. So, you're absolutely right. That can definitely add to the anxiety, the stress, the fear. We get stuck with just our thoughts, and then our thoughts kind of get going in our head and whirling around and around.
That's why I'm loving these caravans where you pass by somebody's house, abuela or abuelo, and you honk the horn and they come out and they wave. And listen, it's 15 seconds, but it makes them happy. And that isolation can just for 1 second be a moment of happiness for them. So those things help a lot. Amy, something that you just mentioned that triggered a question in me, like you said, we're alone, isolation, our thoughts. I think one of the biggest and hardest parts of the coronavirus is the uncertainty, right? Is it possible to change that mindset? Because we ask ourselves, when is this going to end? How bad is it going to get? Can it get worse? Is it going to come back? Will there be a second round? All that uncertainty.
Yeah, that's also a really good question, Olga. I know I've been feeling it. I know everyone's feeling that uncertainty. And there are some things that we absolutely can do to help manage that, because with uncertainty comes stress, comes anxiety, and we can learn to manage that stress and anxiety by just taking good care of ourselves, making sure we're having a proper diet, getting that physical activity, talking to people over the phone via FaceTime. But on top of that, also, like you said, kind of changing that mindset. So thinking about this in a way of, well, if I am struggling with a lot of anxieties and fears about this, maybe I can write some of these down. Because sometimes when we take a look at them, we go, oh, wait, it's a fear, but maybe that's something I really don't need to be concerned about right now. Again, when we have all these thoughts coming in our head, they just kind of merge into one, and it's hard to parse them out. Once I'm able to write them down, I can also take a look and see, is there anything else that I can do? And we also want to remind ourselves that there are things that are in our control. We are capable of managing our hygiene, of how often we're washing our hands, of how we're practicing that physical distancing. How can we contribute to keeping ourselves safe and our loved ones safe as well? So it's always easy to lose track of that, especially because we feel so powerless, unless we're a physician, a scientist on the front line that's really doing something to combat this. And I don't mean to say that in a way that other people aren't, but sometimes we can feel very powerless if we're not in a very active role. But there really are things that we can do, just staying safe, keeping ourselves well, checking in with our loved ones that may be isolated, that may be alone. That's so important, and just letting them know we think about them and we care about them.
That's a good point. And before I get to my question, Olga mentioned the caravans. Yesterday, my wife, my daughter, and I, there was a caravan for one of my wife's coworkers for her birthday. About 10 cars, balloons, streamers. It was pouring rain here, but no matter what we did, we beeped. She texted back with a video of herself crying, saying, "Thank you so much. I love you guys for doing this." It was amazing. We're all having tears because here she is. She's in tears, and that really made a difference. It really made a difference in her day and her birthday. So it's worth it. The caravan, the pots and pans, that works. It's not the best solution, but it works. And Amy, what is the biggest fear most people have about this whole situation?
Yeah, the American Psychiatric Association put out a poll, and it looks like most of us, actually almost 2/3 of us, are really concerned about our loved ones becoming sick or getting the virus. And then on top of that, we're also about half of us are worried about ourselves getting sick from the virus or carrying the virus. On top of all of those things, right, if that's just not enough, we're still dealing with schooling from home. We're still worried about the economic consequences of what's happening here. Our daily lives may have stopped in certain ways, but in other ways, it continues to happen. Just because coronavirus or COVID is happening doesn't mean that, all of a sudden everybody gets along and everything's great. We still have our daily challenges. And then on top of that, we're worried about everything else. So there's a lot of concern out there right now. But, I love how you shared about the caravan. It's so great. That kind of activity, it just takes us into a very creative zone because we can't do things the way we would typically do that. And that creativity actually helps keep us going. It helps strengthen our brain. It's working our brain muscle, and it's so good for our joy and for our connection with other people.
Absolutely. And Amy, do you have personal stories of, patients and people that you have helped out? And my follow-up there is, do you recommend as a family that we talk about it together, that we have conversations about what's going on, that we explain to someone why you can't see tia or tío or abuelo, abuela?
Yeah, that has been a pretty hot topic that I've been talking about with the people that I work with, that along with, if I go to work, will I bring it back home with me? But that communication piece, Olga, is so important. And I also want people to keep in mind that everybody's going to be dealing with this a little bit differently. We're on a different spectrum of how concerned we are about the virus. So that being said, we want to be mindful. Yes, we want to keep that communication open and also acknowledge that people deal with stressful situations very differently. Some people may stay a little bit quieter about it. Some people may talk a lot about it. And so we really have to kind of gauge and see where people are, but try to keep that communication open because it is important to keep everybody safe. You know, one of the situations that I was working with was a couple, husband and wife, and the wife was very concerned because she has some pre-existing medical conditions, and she was very concerned about how to keep the home clean and safe. And her husband was a little less concerned than she was. It happened, you know, like I've heard this story so many times, and it's true, it happens. And then there's this discord in the family because I asked you to do it this way. I asked you to keep the house safe and clean this way. And, you know, a lot of this is just coming to acknowledging and sharing with the other person. I feel very vulnerable right now. I feel very afraid. And I know that you may not feel the same way, but how can we work together so that we can all live in this household and be respectful of each other and help each other stay strong through this?
Very good. Amy, one last question. In addition to the fears about the virus, I mean, the economic shutdown and people losing their jobs can be what sends the people over the edge, you know, for lack of a better word. I mean, and some experts are predicting that up to 75,000 deaths from despair from drug and alcohol overdoses and suicides. What can we do to help change these numbers?
Yeah, that number is so concerning. It's really concerning to hear that number. That's the first time I've heard it, Derek. So thanks for sharing. You know, a lot of this is keeping an eye out and taking an extra step to make sure that we're checking in with those loved ones that we know have already struggled in the past with mental health or emotional issues, with turning to substances and coping, really taking that extra step and reaching out to them, letting them know that you care and that you're here to support them in the best way that you can. You know, at this point, there's no reason to hesitate when it comes to reaching out to a licensed clinician, to a mental health professional, to your primary care physician, and asking them too, you know, this is what's happening in my family and how can I best help my loved one? But we really want to keep an eye out for them because they are at risk. You know, our family members who have chronic illnesses are at risk, and really keeping an eye out for that, because it is very easy for some people to just say, well, I've got, you know, a lot of time on my hands, and you know, it is easy to just turn to a drink or turn to tobacco or nicotine or other substances to fill that boredom or to alleviate some of the stress that comes along with it. So making sure people know that they're loved, they're cared about, that they're included in the family, even if their views are different or they don't have the same thoughts as us, is so important. And then again, not hesitating to reach out for help if you are concerned about them.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
And don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.
School lives have been interrupted. Live routines have been interrupted, been shattered. Everybody's world has been turned upside down, especially the kids' world as well.
That's why we're talking with pediatrician and Dr. Scarlet Constant, our superstar with Baptist Health South Florida. She's here with advice on how to help our children get through these tough times and keeping them healthy, whether they are newborns all the way to teenagers like Derek and I have. Hi, Dr. Constant.
Hi, how are you, Olga? Hi, Derek.
Hi, Dr. Constant. How are you? Everything good?
Very well, thank you. Good
Yeah,
to see
awesome.
you again.
Dr. Constant, I'm going to talk about vaccines. There's a lot of different schools of thought on vaccines. Talk to us about the vaccine schedule. How important is it to catch up on vaccines for kids?
That's a great question, Derek. And actually, it's very important right now, especially, you know, vaccines right now, the vaccine schedule is for the younger children. After age 4, as you know, the kids don't get vaccines again until they're 11, and after that, 16. So the younger kids really need to get not only their initial vaccines, but their boosters, because the idea is to keep up their immunity in general. You want all these antibodies, which I know we've been speaking about antibodies quite a bit. The thing with antibodies is once you have them, early years of life, the antibodies do start to wane down. So the purpose of getting your booster vaccines are to have another spike in those antibodies so that you do have lifetime immunity. So it is very important for the younger kids to keep on that schedule and get their boosters so that they maintain a lifetime immunity.
So doctor, let me piggyback on Derek's question then. If someone has, let's say, a due vaccine to receive this month, next week, and you have parents that are concerned about going to the office, what would you tell them to ease that concern? Because they're maybe thinking, oh, I can put it off, which I personally don't think is a good idea.
Right. It's absolutely not a good idea to put it off. You really want to try to adhere to the schedule as best you can. And I would tell those parents that, as physicians, we are totally abiding by all of the CDC guidelines. I mean, if anybody has been following the guidelines, it's us. The offices we've totally restructured the way a visit is right now. Nobody is in the waiting room. We have early morning appointments for the well kids so that the well and the sick don't mix, even though we have separate well and sick waiting rooms. Now we even have separate times. So it really is a safe time to come in. As a matter of fact, you don't have the rush that we normally have with the back to school rush and flu season rush. If you come in, it's quiet, it's clean, you're in, you're out, and you're safe. So I would encourage parents to have an honest conversation with their pediatrician, and you can ask them. We are totally happy with you asking us, what have you done? What changes have you made in your office? And if you feel that our answer is something that you're comfortable with, then you know that you can come in.
Well, good, Dr. Constant, thank you. That's kind of relieves my mind a little bit because our daughter has this follow-up appointment for a fractured ankle, and we're concerned about going into the doctor's office, other people, things like that. But you're absolutely right. We're going to reach out to the doctor and find out what measures have they taken to try to minimize contact. But thank you for that information. Absolutely great. Screen time. Can we talk about screen time now that there's so much time left over here? The kids are on their phones. I think my daughter's got rectangle eyes now. Not too sure, but how worried should we be about that? About the kids being on the screen on their devices all the time?
Well, I think the question actually, the answer is twofold because you have different age groups and different amounts of screen time. With the very young kids like mine who don't have a full day of work to do and Zoom meetings all afternoon, for me to allow them to eat up all of this time with a tablet would be terrible. I don't think any 6-year-old should be on the tablet 5 hours a day. That is very concerning. For the older kids, they're at school from 8 to 2 or 9 to 1. I think it's fair that when they're done, they have a little decompression time. They need to check out, they need to veg out a little bit and relax. So I think that within reason, allowing an increase in screen time is fine, but again, within reason. I don't think that it should disrupt their life, and I don't think the teens should be on Netflix overnight till 2 o'clock in the morning. You just want to make sure that they're actually still leading a healthy lifestyle.
I've heard from many of my friends that their kids are up till 3 or 4 in the morning. Obviously, they're teenagers. How do you maintain that normal bedtime for all children?
Right. It's really difficult. And, again, I talk to my kids about it over and over. We plan out the day and you have all of your activities, but then I explain, you just can't be exhausted for school tomorrow. Do you want to feel bad all day? We're going to go on a huge bike ride, or let's do this, let's do that. Mm-hmm. So you basically just want to explain to them, like, I need you to stay healthy. This is our time to be healthy and to be sharp. You still have your schoolwork to do. You still have, let's say, soccer. I know everybody's doing things on Zoom. So it's just for your overall health. Like, I need you to get to bed. I know that you're going to be up later, but we need to get to bed and have a certain amount of sleep in order to have a functional day tomorrow. And honestly, with the older ones, if they're not listening, you still wake them up the next morning at the they'll do that only a couple more times. You wake them up.
That's right. I want to get to Karen's question. She actually just emailed us a fabulous question. Karen, thank you so much. I think this is fantastic. She actually put in quotes, virtual hug, something we've never heard of, right? So you're seeing these virtual hugs. Thoughts on that? I mean, what is it?
I know. You know what? They make me cry.
I know.
They make me cry.
Or the elbow hug in the air.
Yeah, right.
Well, What that is right now we are, we don't have anything in place, right? All we're doing is distancing. We're social distancing. That is the only thing that has been proven to contain this for now. We don't have a vaccine in place. We don't have treatment. And so the idea is, in the back of your mind, you have to treat every person that you're interacting with as a positive patient. And if that is the case, you should not touch them or hold them or hug them. And I know that we miss our affection and contact, but aside from your immediate family, right now, we just can't do that.
Dr. Constant, there's a disease out there that maybe it's a rumor, I'm not too sure, but it's called Kawasaki, that I think it's called Kawasaki Suzuki, I'm not sure, that it's affecting children. Have you heard about that, or can you tell us a little bit about that?
Right. Well, Kawasaki disease is a separate disease. What we're saying is that the sequelae, the complication that we've seen so far with coronavirus, is a Kawasaki-like presentation, just meaning it resembles Kawasaki disease in that there's an exaggerated inflammatory response. So as your body fights an infection, we have inflammatory markers that cause fever, cause redness, cause our body temperature to rise to fight the virus. And what happens is in these kids is it's an exaggerated response, which leads to low blood pressure, sepsis sometimes, overheating, and unfortunately death. And so we're seeing that this is a complication after having COVID at some point.
Okay.
Right. Doctor, I wanted to go back to something that you talked about, which is the vaccines, keeping the wellness visits, very important. Is there an age group? Is there a certain child or teenager or infant that maybe should not be going, that could be at risk, that may have to find another option?
Our immunocompromised kids are children that have chronic illness, that have chronic respiratory illnesses. We discourage them from coming into the office, of course. We would rather see them via telemedicine, wait until things are a little bit better before coming in and risking. But aside from being immunocompromised or having respiratory illnesses, other than that, they should definitely come in. As a matter of fact, the group that really needs to come in are our newborn babies and our infants.
Wow, interesting. Dr. Constant, in order to perhaps have the children feel more comfort and maybe get them off the device, and this was kind of hits close to home, is because my daughter's been asking for one. Is it a good time to get a pet to help the kids get through this? What do you say?
Well, I'd say, first of all, your daughter's working you.
Okay. For years, okay, thank you.
And second of all, I think it is a great time, to be honest. I have friends that were doing the same thing, and believe it or not, it was impossible to find because everybody is looking for a pet. I think that it is great because the kids need a place to fit in this puzzle. They don't have anything to do but go to school and go to the Zoom meetings. They don't have anything to look forward to. So to give your daughter a job, per se, is an amazing idea. She would have to have full responsibility, walk the dog, feed the dog, give them this prophylaxis. I think that's great. It's just, if you're willing to take that burden on in your home, that's a discussion that you have to have with your wife. But if you feel that she's responsible enough to do it and could take that on, that would probably change her well-being and her mental health tremendously.
Okay. So it's a thumbs up on your side. Okay. I hope she wasn't listening, but anyway, thank you.
Oh my goodness. Can you imagine all the children now? Can I have a pet? Can I have a dog? Can I have a cat? I want a bird.
Right. The doctor says that we can get it.
Yeah, right.
Doctor, I wanted to ask you also regarding that visit. Do patients, parents, do they have protocols as well when they come in that they need to follow? The mask, gloves, because obviously you don't want to get there and realize, oh dear goodness gracious, I got to go back home.
Right. That's a great question. So we are screening parents. We're actually screening them over the phone and asking if they have been exposed to COVID. And when they come in, yes, they are wearing masks and gloves. And we ask that one parent per child come to the room. As you know, in pediatrics, and specifically in Miami, we have abuela, mom, dad.
El primo, la prima.
So the whole family. So we just can't do that anymore for our safety and for theirs. So we ask that the other parent either waits in the waiting room or in the car, and one parent comes into the room with mask, with gloves, and with their child. Yes.
Can they request a virtual visit for the child if they're sick and they don't want to come to your office?
Absolutely. We have been doing so much telemedicine and it's been working like a charm. It's seamless. Parents love it. We can diagnose, we could look at any skin condition, the rashes, any type of learning difficulties that we want to talk about, emotional questions, emotional health, even sicknesses, sore throats. The older kids, I can look into their throat. They tell me their symptoms. And so with the older kids, it's even easier. They can tell me what's going on and we can diagnose it, send the meds right away. And if I need to see them as a follow-up, I'll ask to come in. But for the most part, we've been seeing them through telemedicine, which has worked wonderfully.
Great stuff, Dr. Constant. Thank you so much for your time. Hopefully we'll have you back in the studio real soon.
So Anna Taylor is a first grade teacher from Broward County Schools. Anna, welcome to the show.
Good morning, Anna.
Hi there. Good morning.
Good morning. Thank you so much for joining us, Anna. Boy, do we have a lot to talk about, don't we?
Of course.
I mean, we could be here for hours.
Absolutely.
But I guess the first thing that comes to mind is just how suddenly, for many parents, they've become their kids' primary teachers. Let's be honest. I've actually helped my kids with their calculus and geometry. Boy, have I had to Google a lot of information. Woo! Really hard on the kids to go through all this, right?
Absolutely. My heart breaks for these kids. My heart breaks for everyone. It's such a trying time for everyone, whether it's educational concerns, financial concerns, instability concerns. And we as adults have so many more coping mechanisms to handle the stress and the pressure of the unknown and this scary time. But these children, they're sad, they're upset, they miss their school, they miss their friends, they miss their teachers. It's been so hard, but we're getting through it.
Yes, we are.
Absolutely. But, unfortunately, the kids are not learning as they should if they were in school. I mean, and Anna, beside Teachers Pay Teachers website, for example, what advice would you have for parents to help their kids learn better, get smarter, and not fall too far behind?
Well, I think that finding a happy balance. Some children that are very motivated to learn, it's going to be much easier to work with them at home. Children with special needs, children with hesitation towards school, children that don't work well for their parents but work better in a classroom setting. It really is just trying to find what works for your own children and finding that happy balance. I don't think that it's a realistic expectation to sit a 6-year-old, an 8-year-old down at a kitchen table or at a desk from 7 o'clock in the morning until 3 o'clock in a classroom setting, because even school isn't like that. We get up and we do movement and we do songs and we go to specials and we go to lunch and we have recess. So I think just being able to understand that, especially primary children, that they need breaks and getting the time when they're ready to learn. If your child wakes up and they're a little groggy or they're having a bad day, don't force it. You have to kind of capitalize on that opportune time to get them to work, whether it's setting up a schedule every day. Some children thrive on every single day at 9 o'clock, we're gonna log in and we're gonna do what we need to do. Other children, you need to be a little bit more flexible. And so it's hard, there isn't one specific recipe for success. I think you have to know your children. You have to know your work schedule. Some of those parents that are working a 9-to-5 job at home and trying to balance in school, maybe it might be better for them to not do so many academics in the morning, but to then work in the afternoon when the parents are kind of winding down. And so just trying to find that balance. And one of the things that I have discovered so pleasantly is so many websites have made access free to teachers and to children of all ages, whether it's Scholastic Books, whether it's Epic, that has an online reading platform. There's so many wonderful websites. I could go on and on and on and tell you about them, but you really, if you're looking for things that you can just go online and research, there's so many wonderful academic websites to use that have become free, available for everyone.
Great stuff. Something that I don't think is going to be available for everyone is camp over the summer. My guess is probably they're going to be closed. Any advice for parents, caregivers on how to help everyone just stay sane?
Balance, I think, is the first thing. And finding the time to have unstructured time that's not digital. I think so often an easy recipe is just to give a child a tablet or give them a phone or say go play on the computer. But I think having that screen-free time is going to be vital. Setting up a routine and a schedule to say, okay, you have limitations. You can use your device for 2 hours a day or whatever works best for you, but then getting them outside, getting them into the swimming pool, getting them outside to ride their bikes. And that's hard. You and I both know what's coming up here in South Florida, the weather. It's hard to go out and to be outside for a long period of time because the heat is just so oppressive, but really trying to find screen-free activities, whether it is establishing a new hobby, whether it's coin collections, stamp collections, art projects. One of the things that I've been doing with my own children is teaching them some of my favorite recipes, getting them into the kitchen. And that's such a fabulous learning opportunity through math and measurement. You can teach your fourth grader fractions while you're teaching your little one how to stir accurately, which is a fine motor skill. So pulling them into the kitchen with you is a fabulous way to teach non-traditionally, but you're still teaching at the same time. So.
Thank you, Anna, so much for your time. And I'm sure when schools open, your students are going to be so happy to see you in the classroom.
I can't
You
wait
sound
to
like
see
a
them and give
fabulous
them a big
teacher.
hug.
Thank you so much.
Thanks for your time. Be well.
Now we'd like to turn it over to two great guests, Ariel and Iris Epstein. Again, this is mother and daughter. They are both coronavirus survivors.
Welcome, ladies. Can you tell us a little bit about yourself? And then Iris, after that, you can tell us as well.
I am a 25-year-old who lives in New York. I actually lived in North Carolina for about 3 years, moved home a year ago. I host a sports talk show it's on a network called Sports Grid, and we talk all about sports gambling. But even though we live in the suburbs of New York, which is about 40 minutes outside New York City, I had to commute every day into Manhattan or into New Jersey, which is where the FanDuel Sportsbook is. So we live in close proximity to Manhattan, which is why we kind of have been able to see this whole COVID-19, the coronavirus pandemic, pan out kind of ahead of a lot of other places in the country.
Iris, I wanted to ask you, okay, here we go. From one mom to another mom, okay? You realize you have the coronavirus.
Mm-hmm.
Oh my gosh. Were you scared?
You know, my daughter and I got it at the very beginning when it first became public. So a lot of the media was really saying that basically you could die. You know, there was it was very black and white, especially the media around here. It goes to your chest, it's respiratory. And for me, it was just about, could I go to sleep? Can I die in my sleep? My daughter, I looked to see if she was breathing at 25 years old. I think for me, that was the biggest thing. Other than that, for us, thank goodness, it was just the flu, very flu-like symptoms.
So what were you feeling? Were they the chills, headache?
So we started with the chills. Yes, the headache is a big one. So we started with chills, a small, a low-grade fever, and what else? I had gastrointestinal issues. Ariel didn't. She had it more in the chest, which made me concerned. We were very tired. I think I slept all day.
For 2 weeks.
Yeah, I put my yoga mat on my patio outside, just thinking I was going to get sun, and I felt that I just couldn't get off the mat. I just laid there all day, and that was before we knew that we had it. So
we got it. So March 15th was the first day of our symptoms, and if we put it in perspective, sports started shutting down March 11th. So that's kind of when I think everything ramped up in the country, was when the sports world stopped. Then March 15th, we both felt the chills and we both felt very tired. We couldn't stand for long periods of time. Come Monday, we were out for the count. We couldn't get off the couch. And the weird part, I think, was our symptoms kept transpiring into something different. It started out as just us having the chills and being very lethargic for a few days. We actually started feeling better about 3 days in. we thought we were good. We started trying to walk down our street, go outside. We thought, and we're both very in shape. We work out 4 to 6 times a week, both of us, most active in our house for sure. We couldn't make it back. Like, we thought we wouldn't make it back up our street. Got so tired. Then we did feel a little bit better for 2 days, and then the symptoms kind of all came back, and a little bit worse, I would say. That's when my breathing started to go to my chest. And we just got really tired again, and we got the chills again for a couple of days. Another weird symptom I had early on was that I got like a little bit of eczema on my hands, and I have like skin sensitivity to certain things. Like, I just need to use Neutrogena all the time. I could break out into rashes from a suntan lotion. So I thought that maybe I just used a lotion at work a few days prior that made me a little bit allergic. Then when we went for the COVID test, which we couldn't get our hands on for about 2 weeks, one of the symptoms was eczema. Then I realized that my hands probably had one of those early symptoms.
We also had the taste and the smell, but they hadn't come out yet on, in the media saying that. Where I usually have a granola bar in the morning.
Yeah,
it was like eating sandpaper.
We split one granola bar because we couldn't finish it.
But you guys are feeling great. You look great today. Things are great. You got through it. And we're hearing so much of that, which is great news, right? You're doing good.
You're
good.
Yeah,
great.
Totally back to normal.
Yep.
Are you, either one of you, worried that you might get it again? It hasn't been proven that there's, again, rumors out there that you might get it again. Are you worried about that at all, or have you looked into that?
I think it's always on your mind, but I try to stay positive, just knowing I work in the science field. So for me, I really do trust the power of immunity and our immune system, especially because we're not immunocompromised people. So we don't have no one has high blood pressure. We don't frequently get sick. We don't have any other cardiovascular issues. No one's pre-diabetic. But then again, I'm in my 50s, so I feel it for me that my age would be the only thing not on my side. But then again, it's more, I think men are higher risk even than women. So I try to just use those type of factors to
My concern's more about my parents and my grandparents than it really is about me. I was a little nervous when I couldn't breathe deeply. That was, for me, the breathing was about breathing deeply. I'm not sure if anyone's familiar with yoga, but they make you do these 10 deep breaths pre and post yoga. That's what we kind of turned to, because when I would try to breathe in through my nose deeply, I would cough out. It was a little bit of a weird feeling that made me nervous, yet I know that I don't smoke, I don't do anything to compromise my body, I'm very healthy, I'm active. So I wasn't as concerned for someone at 25 as I am for my parents and my grandparents to potentially catch it again.
Makes perfect sense. Ladies, what about the stigma associated with this coronavirus? Do you still face some uncomfortable reactions from people? Like, I have a friend of mine who I have actually several of my friends that had it, and they're fine. They're doing fantastic. Each had their, different symptoms. But they'll tell me, so people, you hear coronavirus and people go, whoa.
Yeah, that makes me laugh, actually, because if you,
right?
If you trust your immune system, I try to educate people that I'm actually one of the safest people to be around, from what we know now. I tested negative and we both have the antibodies. So besides for maybe something that I touch and then I could touch you, I'm actually pretty safe to be, let's go on the fact that we said with Derek's question about can you contract it again, then I guess you could be a little bit nervous. But at this point, I'm assuming our friend should be happy being near me.
Especially like the doctor said that, your antibodies might not last for forever. However, at this point, if we have the antibodies, we're hoping that any kind of interaction with the virus, at least in this next few months, since we do have the antibodies, that hopefully it would fight it off.
And then speaking of the antibodies, there's a program out there that uses the treatment of plasma from recovered COVID-19 patients. Are you thinking of participating in that program to help other people out?
We're signed up for June 5th to donate. We've actually been using Mount Sinai as our kind of crutch for all of this. They've been helping guide us through the last 2 months because remember, we were the first ones to really have it, which means we're the first ones to take the antibodies test. We're the first ones to give the plasma. That's why it's been interesting to see from everyone around us. They've kind of been using us as a source for information. Where did you go? Mount Sinai actually opened up so that we didn't have to go to Mount Sinai in Manhattan. They opened up a mobile unit, which is closer to where we live. We were able to make a 10-15 minute trip. We were able to take the antibodies test, which is a blood draw. They submit it into the lab, and then Mount Sinai or the lab, they call us, and then we set up a plasma donation appointment.
I really love talking to you two because I always say we need to hear more from people who, had it and are doing great today. And for me, it makes me feel better, to be honest. What would you say to people out there who are, scared and with good reason? But I love how you can empower and educate us.
So I think that the first thing to do is realize that if you're not a high risk person, so you don't have any, previous medical problems, most likely it will affect you like any other virus. Feels like a cold, you just have to rest, take care of your symptoms, but not panic. I think it was the panic that really made my condition worse. When you don't know, it's scary. The unknown is always scary,
and the mind will play tricky things, right?
Very tricky things. And I think the therapist that you had on before said it best. Your mind wanders, our structure is off. We can't distract ourselves throughout the day as much as we can when we get dressed, we go out to work, and I don't, so to me, you just have to
we continue to try to work, and it was really helpful for me. I can't speak so much for her because I'm sure it was more concerning having a daughter who also contracted it. For me, having my mom, and every day we'd wake up in the morning and we'd see how each other felt. It definitely put my mind at ease to see that she was going through exactly what I was going through. It didn't make me feel like I was alone. Whereas for the other women which I guess we should mention, we were at a dinner full of 9 women for my mom's friend's birthday, and 6 out of the 9 women contracted the virus all within the same time. So we figure it's from the dinner. Then everyone who was on the phone with us when we would have conversations, what are you feeling? They felt alone in their homes because no one else had it, whereas we had each other.
That's nice. That's so great. Derek?
Well, as a matter of fact, speaking of restaurants, you were there, you contracted the 9 women. Is there any place you're not going to go to today, like a restaurant or the beach or anything like that?
Where we want to go to, you said?
That you would not go to, for example? Yeah. Or would go to?
Well, we really want a pedicure, but here in New York, things aren't open.
I just made an appointment for next week.
That's what we want.
Just a pedicure, a simple pedicure.
That's kind of what I got lucky that about a day before I contracted the virus, I got my hair done. So that was 2 months ago. We're kind of waiting for things to open. Unfortunately, since we are 40 minutes away from Manhattan, we're probably going to be one of the last ones to start entering the phases of non-essential workers. We're just trying to do our best at home. We food shop. That was probably the biggest issue when the two of us got sick.
It's my husband and my dating. That's where we date now. We go to a new supermarket all the time. That's
their date. My
That's
parents
what we do.
go on a date to the supermarket.
Ladies, can I ask you a quick question? Do you still wear masks and gloves and social distance? Actually, you know why I'm asking that? Because Karen asked us to ask you that question. And so she emailed us that question. It's a fabulous one. What's your answer?
We do when we go into places, if we go to a supermarket, if we go to Dunkin' Donuts, the thing that we did to get out of the house was we like to take long walks. So when we're on long walks, we'll social distance if we come in contact with someone else who's walking. Usually someone goes to the other side of the street. We don't wear masks though when we're on a walk. First of all, I'm on TV 6 days a week. I don't need a tan line of a mask. But we're definitely social distancing from people though when we're out on the streets. Yet when we go into a Dunkin' Donuts or any of these public spaces that are indoors and enclosed, we put on masks.
I'm not sure about Florida, but in New York, it's mandatory.
Yes, and it's mandatory here in some places as well. And like we had with our last guest, our Dr. Constant and the teacher, it's out of respect. You know, if I'm wearing my mask, I'm taking care of you and you're taking care of me.
Right. Like people
Common
don't know
sense.
we had it. They don't know we had it. So I think it's just, we're being sensitive that everyone should
Feel comfortable if they're
Right.
out of their homes.
correct.
Very good. Olga, you're very good at asking the questions to close out, always ending on a happy note. Do you have a question for them to end on a happy note for us today?
Well, I always like to end on the positive side because Derek knows that I never say the glass is half empty. I always say it's half full. So both you and Mom, if you could condense this into a fabulous soundbite for anyone out there, our fabulous viewers who are watching, how has this experience changed you for the better?
I would say we're happy that in a sense we were able to kind of go through this together and be able to spread optimism to people the same way that you mentioned. It's good to see people who were able to come out on the positive side of this. As many of us who've worked in news, we know that a lot of the time the story is about the sad things, not so much the happy. The reason I came out with this when I was working is because I wanted people to know just because you contract the virus doesn't mean that you have to die. I think that it's important for people to know as long as you do things the right way, you take care of yourself, then you could come out on the other side just the same way you would with the flu. I think that it's important that we were able to have this early on so that we can go through the process and be able to spread optimism throughout the country, because I think we're in a transition phase now of healing as opposed to, you know, being so scared. Now let's try to heal.
We want to thank you so much for being here and sharing your experience. We are honored to have you. Thanks for joining us today.
Thank you for having us.
We'll see you next time on The Smart Life. Thank you for joining us.
That does it for this edition of The Smart Life on the Health Channel. All health, all the time.
The Smart Life program is only for education and informational purposes. Smart Life is not a substitute for or meant to replace advice from medical professionals, diagnoses, and/or treatments. Always consult your doctor with any questions you may have regarding a medical condition. Do not ignore the advice of your doctor nor delay any recommended treatment based on what you have seen or heard on Smart Life.